who have diabetes, or you may have diabetes yourself. Diabetes affects 459 million people worldwide. To put that in perspective, in every 11 people have diabetes, and in every 6 seconds, there is someone dying from diabetes. That's what makes our question so important. What is diabetes?
In diabetes mellitus, your body has trouble moving glucose with a type of sugar from your blood into your cell. This leads to high level of glucose in your blood and not enough into your cell. In general, the body controls the blood glucose level by two hormones, insulin and glucagon. Insulin is used to reduce blood glucose level, and glucagon is used to increase the blood glucose level. Both of these hormones are produced by pancreas.
Type 1 diabetes is caused by the immune system destroying the cells in the pancreas that make insulin. This is called an autoimmune reaction. There is no specific causes, but the following triggers may be involved are
viral or bacterial infection, chemical toxin within food, unidentified component causing autoimmune reaction. Risk factor type 1, family history. If you have relatives with diabetes, chances are strong you will get it too. Disease of the pancreas, they can slow its ability to make insulin. Infection or illness, mostly rare ones, can damage your pancreas.
Type 2 diabetes causes is usually multifactorial. Often the most overwhelming factor is family history.
Risk factor type 2. Obesity is the major type 2 diabetes risk, with millions of people throughout the world facing obesity. Lack of exercise. Being inactive often leads to being overweight, which can lead to pre-diabetes and type 2 diabetes. Bad diet is a major cause. High cholesterol and blood pressure levels. Gestational diabetes is another major risk and affects about 2 to 5% of women who fall pregnant. Family history. Having a close family member with type 2 diabetes can raise your own risk of developing the condition. Aging. The older we are, the greater risk of developing type 2 diabetes is.
The steps to prevent diabetes by eating healthy food, staying healthy weight, and moving more every day.
Both types of diabetes have some of the same warning signs. First, hunger and fatigue. Second, peeing more often and being thirstier. Third, dry mouth and itchy skin. Fourth, blurred vision. Other type 1 symptoms: unplanned weight loss, nausea and vomiting. Other type 2 symptoms: yeast infections, slow healing sores or cuts, pain or numbness in your feet or legs. Call your doctor if you first feel sick to your stomach, weak and very thirsty. Second, peeing a lot. Third, have a bad belly ache. Fourth, breathing more deeply and faster than normal. And fifth, have a fruity smell breath.
Diabetes is a chronic disease, an incurable disease, but we can manage diabetes and continue life as normal.
Patients must changing eating habit to proper, increasing physical activities, taking medicine correctly to keep blood glucose levels, blood pressure, cholesterol and other factors as close to normal as possible. That can decrease risk for diabetes complications. People with type 1 diabetes require multiple insulin injections each day to maintain insulin levels. People with type 2 diabetes require medicine to improve the effectiveness of the body's natural insulin, increase insulin production, and reduce blood glucose levels. In pregnancy, must antenatal care should see the doctor every doctor appointment, having strict dietary management, exercising for pregnancy, and sometimes may be treated with medicine.
Both type 1 and type 2 diabetes patients have high blood glucose. There are several tests you can use to diagnose diabetes.
The first test is called fasting plasma glucose or FPG test. This test measures the amount of glucose in your blood after you have been eating for at least 8 hours. Diabetes is diagnosed when fasting blood glucose is 126 mg per deciliter or higher in two laboratory tests that taken on different dates. A second test is the oral glucose tolerance test or OGTT. This test checks blood glucose before and 2 hours after drinking a glucose liquid. Diabetes is diagnosed when the glucose tolerance test level is 200 mg per deciliter or greater. Another test is hemoglobin A1C test. An A1C number represents how well your blood sugar has been controlled over time, especially over the last 2 to 3 months. Diabetes is diagnosed when an A1C is 6.5% or higher. If one or more of these tests are positive, we will repeat the test to confirm. If test results are over normal range but less than the diabetes range, you may have prediabetes.